I had a question. Why aren't doctors as up to date on it, especially the newer doctors? I feel like I understand that they're getting trained by, the professionals that have been in the field longer than them, but why aren't they as
Yeah,
up to date as we are?
yeah,
For
yeah. It's a good question. And actually, there's another website that's actually called Up to Date that I think strives to keep doctors, oncologists specifically, up to date on new findings and that sort of thing. Um, but I think the answer to your question is a much more sort of insidious one in the system, which is, the way that trials have been distributed and continue to be distributed. Phase one trials are usually in the hands of a few doctors who specialize in looking at new medicines and characterizing the side effects and helping patients to do the best they can. But it's not in a lot of hands, right? So, which means that in order for a patient to go to a clinical trial, phase one or not, um, that they'll have to leave the doctor, right? Now, the doctor, wants the best thing for their patient, but their center wants the patient to stay at the center, right? Because they're treating the patient and so every time the patient leaves or and it would be fine if the patient, maybe one or two patients left, but if all the patients were going on trials, then you could see a problem arise. And so I think that there's a lot of incentives, unfortunately, in the system. And I would like to change that. I would like to see, first of all, doctors have more access to these newer therapies so that they can actually participate and don't have to send their patients away. It's actually it's hard for the patient too when they have to travel far away from where they're at. The second thing is though that that again I think that we have to change the way we think about drug development and new cancer cures. In that again, there's a lot of information, a lot of ideas, a lot of data that goes into figuring out how this drug could best be used. And the better we do at matching those theories to actual real patients through things like next gen sequencing is the way to improve the outcome for all. And so, to me, I understand. I don't think that those reasons are discussed here, but I think that that's likely why. And there's other issues as well, but I think that's the primary one.
Thank you.
Yeah. Any other questions, comments, or feedback on that? Right.
I find it just sort of unbelievable that there's a doctor out there who heard that their patient was called a guinea pig and thought that that was an acceptable thing to continue saying to more patients. That's really mind-blowing to me.
Yeah, yeah. And again, I mean, I think the first part is true. They need a miracle. They're looking for something. And I mean, it's not really a miracle, right? They're looking for something that the standard of care doesn't provide them. Every clinical trial is designed to give patients something that the standard of care doesn't provide them. Otherwise, we wouldn't be doing the trial. So it's a shot at doing better. What you classify as a miracle or not, I don't know. But from my perspective, that is at the core of why we try to do better. We're looking for cancer cures. We're trying to develop better drugs. And the idea that that patients are guinea pigs is just again, it's just so old. It's that, it's the idea that a guinea pig is going to be tortured and subject to tests and treatments without any possibility of benefit. And that's just not true. But yeah, I'm right there with you. Preaching to the choir, I know. All right.